Good day, everyone, and thank you for joining us for yet another session. Compliments of Care Nursing Agency. Thank you, Keisha, for inviting me over again. I'm beginning to, make my home here pretty much. And I want to thank you for that, for always being so welcoming and so inviting. But more so, I want to thank you for your dedication to not only patient care with a K, but also the passion you have for educating individuals. It is so important, and just today I would have had a meeting earlier this morning where I discussed the need to just how important disseminating information is right now. One of the challenges we face as medical practitioners is patients not knowing what the truth is anymore. We're in an era of fake news and so much misinformation and disinformation that people are finding it very difficult, very challenging to navigate so much information from so many different sources and deciding what the truth is. And whilst that may have its effect on people's political views, we are not politicians, we are scientists, in the sense that we're medical practitioners, healthcare practitioners, and we see the ripple effects of this. We see the consequences of that misinformation and the toll it takes on an individual's life and the decisions that one makes about how they go about living their life. So it's so important, again, that we not only come at the back end when that disinformation has already played out and someone is now suffering from an illness and we're trying to prolong their life on this earth or save their life or reduce their suffering. It's important that this is part of our preventative approach to medicine and to healthcare. And this is why whenever an opportunity like this presents itself, I try to shift my schedule around to make sure that I can accommodate it. One of the areas that I had already presented to your audience here before, and you invited me to do it again, was in regards to kidney failure. It is an area that, like many things in medicine, is there to me, and this is becoming my buzz phrase these days is there to me. Well, they're there to me. Anybody who knows me knows that NCDs, and by NCDs I mean non-communicable diseases, are something that I am very passionate about, because the truth is, it is perhaps the biggest existential threat to myself and to my family and those I love. I am least concerned about someone in my family dying from an infectious disease today, and that includes COVID-19, than I am that I will get a call that somebody in my family suffered a stroke or heart attack, or somebody in my family has kidney failure and did not make it, or suddenly somebody has to dip into their pocket and pay exorbitant fees just to give that person some quality of life. And one of the areas where that can really drain the finances of a family is in treating or managing someone with kidney failure. I'd like to start by saying that the anatomy of the kidney is such that every individual is typically born with two kidneys. In the earlier stages of growth in the womb, the kidneys are located more towards the pelvis area, the lower portion of the body, and as you develop in the womb, it ascends slightly and it moves and locates itself towards the loin area, the back region, so one on either side. Typically the orientation is that it looks like a kidney bean, right? Red beans, if you will. Those of you might know it as that. And from that, there are two, I like to call them straws, that come from both kidneys, called the ureters. That's what drains the urine from the kidneys and then passes downwards into the bladder. And then in the bladder is that little area. I'm sure everybody probably know where the bladder is. Even if you may call it by a different name, there's an area that when you want to pee, there's that little pain you feel right below the umbilicus, right around the mons pubis area, that is extremely uncomfortable. That's where your bladder is. And then, of course, there's another small straw, shorter in women and longer in men, called the urethra. So the two names are very similar. Ureter and urethra are different. So the urethra is the one that is a prolongation of the genitalia, but the ureters are the ones that come from the kidney and empty into the bladder. It is not uncommon to find individuals with different types of malformation. For example, where one kidney may have stayed down in the pelvis and failed to ascend. Right? There will be a case where the kidney is missing, one or two absent. There are cases in where one may be malrotated, where rather than the two ureters facing inwards and downwards, one is actually facing externally. So there's sometimes a malrotation of the ureters. There are instances where that straw may be bent upon itself. And if it is, that is a kink that prevents adequate drainage of the urine, or the straw is not patent, meaning that it's blocked from birth and does not allow for urine to flow adequately. I would say that so important are these organs, and just to stick a pin here for a second, I speak about just how marvelous God is in his wisdom, and how he goes about doing things, that he's found a way to ensure that vital organs, he either give us two of them, and when he give us two, he made sure he protected the others. The brain is in a very firm vault here that allows for adequate protection. The heart is surrounded by the ribs and nicely tucked and cushioned by the lungs underneath it, and the kidneys, he gave us two of them just in case one gets messed up, that we have a second one. So that just shows God in his wisdom says, you know what, these kidneys are extremely important, and there's a good chance that there are going to be a few Caribbean folks and Kititians who are going to eat poorly, and they're going to mess this up at some point. So I'll give them two just in the event, right? So thankfully we have two of them. And I will speak to the number of things, the number of insults in terms of, from medical term, that can cause injury to the kidneys over time and can affect one or two simultaneously. So the kidneys are located, as I said, in the back. That's where most individuals, when they have kidney stones or kidney pain, they usually feel them in the back area. Anybody who's had a kidney stone can relate to how that pain is. Usually they find there's a loin to groin pain, where you feel the pain from the back and it goes downwards and slightly forward. It comes just underneath the belly, if you will, or the abdominal area there. So those malformations, and then of course one of the other things would be polycystic kidney. Just like you have ovaries, they have a number of cysts on them. The word poly mean many, and cystic meaning cyst, the fluid-filled sacs, and so on. So polycystic kidney is also a thing. A lot of those things can, in one way or another, predispose someone to those kidneys malfunctioning over time, right? And I'm talking about things that somebody has been born with, and it's not acquired, it's almost innate in a sense, and those things can predispose individuals. But that is not the biggest problem we face today. The problem we face today are individuals who their kidneys came from the pelvis, ascended nicely, they rotated properly, there's no cysts or anything, there's no kink on them, there's no lack of a kidney, so to speak, there's no blockage of any kind. The kidneys have been perfect, but we, through lifestyle or through some habits that are noxious, that can prove to be deadly or detrimental to the kidney, we have become our own worst enemy by doing things that have led to kidney damage over a period of time. And this is the reality we face. The reality we face today is that a lot of what we see in terms of kidney damage is something that, to some great degree, was preventable. And that's where I would like to place the bulk of the focus on today when we speak of kidney failure. And what I mean by kidney failure, if I were to speak in very layman, very simplistic terms, it means that your kidney, which once had the ability to rid the body of toxic substances, everything that we eat and is digested and is metabolized is excreted one of three ways: respiratory, right, through the lungs, through our feces, right, to some extent to a sweat, so maybe we can use put a fourth there. But then a very important way through the kidneys. Almost anything we consume is going to go through the kidneys because it makes its way into the circulation, into the blood, and our entire circulation several times a day passes through our kidney, and our kidney filters those substances. Some remain and others pass through the kidney and are excreted in our urine. So a urine test can give a lot of information about somebody's state of health. A very simple, very inexpensive test can give a lot of information about someone's state of health because a lot of things are filtered through the kidneys. So when you get to a stage, and that doesn't happen overnight, all right, and that's why there are different stages, and some up to 5 stages of kidney failure. And when you get to the 5th stage, well, things are really, really bad. But over time, progressively, what happens is that kidney function is reduced, right? So if you were to look at the kidney now, we spoke of the kidney in a very macroscopic sort of way. Like if you just look at the kidney, it's this big red kidney bean looking nice, and it has a nice little sheen to it if you were to cut open and look at the kidney directly. But if you were to slice that kidney open and look at it under a microscope, there are millions of substances not substances but structures in there referred to as nephrons. All right, and those nephrons, those millions of nephrons, these are the guys, each of them are actively involved in the filtration of substances. Right, when things are broken down in the body, they are filtered through the nephrons. And over time, what you have is a loss of nephrons or nephron numbers for one reason or the other. And as that is lost over time, be it because there's an autoimmune disease, be it because there is some other infectious process, right, that leads to damage of the kidney, and then you have scarring afterwards. Because when that happens, that is replaced not by new nephrons, it's replaced by scar tissues. Like if you had a wound and you got a cut, yes, there's skin, but if you notice, the skin has a slightly different appearance to the rest of the normal skin around it. The same thing happens in the kidney, right? And there's an infection that heals, you have a scar tissue formation there, and then the nephrons that were once occupying that area are lost. So kidney function over time is affected. And the more that happens, the more nephrons you lose, and the more nephrons you lose, the less the kidney's ability to compensate. And I'm talking about millions of nephrons in one kidney, and God gave you 2 of them, which means that God is saying that these people are going to screw this up, but I'm going to build some redundancy into this by giving millions of nephrons twice, and still will mess it up. And it's we don't have to go very far. Some of us within our own families, within our own workplaces, we know somebody who's struggling with kidney dysfunction, right? If they're not at end-stage renal disease, which is the other term for kidney failure, they are at some stage of it for one reason or the other, right? So these individuals, so when we say that somebody has frank kidney failure, where that person now needs dialysis, that person now needs to be hooked up to a mechanical kidney, if you will, that person has one of the things that we measure, which is called the glomerular filtration rate, and I'll explain a bit more what that is, of less than 15, right? So when that happens, when you get to that stage, well, somebody needs to put their hand in their pocket, all right? And it's for 2 things. It's either for dialysis or for, well, what are guys here who are into the undertakers, liming or one of those things, right? So it's either you're dying or we're trying to save your life. That's the reality of it. The reality is that somebody cannot survive without their kidneys functioning properly. If you are end-stage renal failure and your body doesn't have the capacity to drain those toxic substances from your body, then it's incompatible with life. That is the reality. So it is so important that not only do we engage in lifestyle practices that sort of curtail that from happening, we engage in lifestyle practices as well that, one, protects our kidneys, but also as well, part of those lifestyle practices is that we perform regular checks. One, we recognize some of the things that we are. Again, I was saying that one of the important things to ensure that we preserve kidney function and to preserve the millions of nephrons that the good Lord blessed us with in both of our kidneys is to ensure that we engage in lifestyle practices that does not do any damage, one, in terms of the foods we eat, in terms of our indiscriminate use of medications, and even sometimes seemingly benign medications like painkillers, right? We have a culture of abuse of pain meds, and I say abuse deliberately in the sense that there are many other things that we can do to sort of manage pain, chronic pain. For example, weight loss. We're carrying around more weight than we need to be carrying. Case in point, I usually, I would say that whenever you point at somebody, there's 4 fingers pointing back at you. So I do recognize the need to perhaps take the lead on this, and typically I exercise, but I don't always get it right. So I understand the struggle. So this is not me being condemning in any way, shape, or form. I'm simply saying that that we must recognize the need to engage in healthy practices and the use of pain relief. A lot of times that we engage in is to actually sort of a band-aid approach to things that we really should deal with in a more decisive way. So we're digressing a little bit here, but further to those lifestyle practices, and I would say that part of the lifestyle practices is not just diet and exercise, it also means proper, emphasis on proper, and regular medical checkup. We may not be able to stave off a lot of the diseases that we're confronted with. Diabetes, as you know, there's a genetic component to it. Hypertension, essential hypertension. I always tell people that 70% of individuals are going to be hypertensive by virtue of being black, right? It's idiopathic or essential in the sense that there's no real established cause for our hypertension, but as black people, we are more prone to it. And so even some of us who exercise regularly and try to eat healthy are going to end up with one of those diagnoses at some point. But whilst we may not be able to prevent the disease per se, we can prevent the complication, right? So you may not be able to prevent yourself from becoming hypertensive, although you can delay it by engaging in healthier practices, but you can prevent the complications that ensue. And one of these complications is chronic renal disease. And I'll explain how the two things are correlated, right? Why diabetes leads to chronic renal disease and why hypertension leads to chronic renal disease. So it's so important, and it's unfortunate that a lot of times in my practice, I would come across individuals and you've been a diabetic for a very long time. And not only are you a poorly controlled diabetic, nobody has done checks which are inexpensive or non-invasive checks to have an idea as to what your kidney function is, because we can do those things that allows us to get an idea of whether this individual, if we don't make some drastic changes to either the control of their chronic illness or the type of medications that they're using, if we don't make some drastic changes, that individual in a couple of years is going to need dialysis. As I said, if we're going from 1, 2, 3, 4, 5, it's not a matter of somebody wakes up tomorrow morning and they're in renal failure, right? I'm talking about a million and so nephrons. Unless you suffer some type of injury, a gunshot wound, an accident that has caused damage to your kidneys in one fell swoop, unless that has happened immediately, and that is hardly ever the case, it means that we have sufficient time, right? Because one of the things I want to talk about is also the other classification of renal failure, and that some of it is acute and some of it is chronic. Acute renal failure is typically reversible. So you may have somebody who becomes very dehydrated, for example, and you have that sort of pre-renal injury, so the injury is not really in the kidneys per se, that individual who's dehydrated and the kidney function is compromised for some reason or the other, with proper hydration, that person can regain their kidney function. Right, somebody who has a particular infectious process, glomerulonephritis from some microorganisms, streptococcus, whatever the case may be, may have their kidney function temporarily impaired, but that person with the right treatment, and assuming that they don't continue to get those infections over time, can have the kidney function restored. Right, so this is the individuals who have acute renal failure, but I'm talking primarily about those who have chronic renal failure. That if I have a patient in my care with a chronic illness, and whether that illness is an autoimmune disease like lupus, for example, I was surprised that I was in Nevis on the weekend, and I was at Alexandria Hospital, and I went across to get a drink at a shop. And whilst I was there, I looked at the shop attendant, and I asked, well, and it's just me having that sort of clinical eye and always have that intellectual curiosity. I look at everybody through lenses of medicine. I walk around town, I look at everybody, and I always assess people through those eyes. It's a good and bad habit, because it's always very disturbing that I go out with my friends and I look into the cornea and see if they have a corneal arcus, and I talk about their cholesterol being high. But to myself, I don't tell them, because I would hate to compromise the interaction. But I look at everyone through that. But anyway, I went to see this young lady at the shop, and I said, I hope you don't mind me being invasive. By the way, my name is Dr. So-and-so, and do you have lupus by any chance? Do you know what lupus is? That's what I asked. I said, do you know what lupus is? She said, why? I look like I have it? So I said, no, just curious. She said, I have it. And we went into a conversation, and she started talking to me about her care and some other things. And the long story short was, I was asking about her kidney function. And she said, well, I don't know that. I'm not saying that it hasn't been done, but I'm saying that somebody with lupus should not, your kidney function should be so front and center, amongst all the other things, should be so front and center in terms of part of what happens as your follow-up. That is not something that you should be playing a guessing game as to whether it has been checked or not. The method that she could not recall is very concerning to me, right? Or somebody who has diabetes and I say to you, well, have you ever checked to see whether there's any albumin? And albumin is protein, essentially, in your urine. And so I said, I don't know, doc. I said, but nobody has checked to see whether you're having any protein loss in your urine. And no, they haven't, right? So those are the things that are concerning to me, because I'm saying here is a disease that is extremely expensive. If you're in the US, you will spend you can spend anywhere between $50,000 to $85,000 US a year on dialysis. Not many people make that salary. And you know what is unfortunate? The majority of individuals who need that dialysis are the ones who don't make that kind of money, right? $50,000 to $85,000 US a year, and sometimes more, on dialysis. That's the cost. And whether you're paying for it yourself, or whether the country is providing for you through the government, somebody's paying for it, right? So it's really expensive. Somebody who's on dialysis does not have a real quality. The quality of life is significantly impaired. This is not someone who can take on a job that is demanding, or a job that requires them to be fully engaged and fully committed and show up on the job every single day, because at least 3 times a week you need to be at the hospital for several hours to get dialysis. Your quality of life is significantly impaired. So the question is, what can we do, right, to ensure, as practitioners and also as patients, what can we do to ensure that we prevent as many people as possible from going down the route of becoming patients with chronic renal failure, right? So those are some of the things that I want to discuss right now, in the sense that we must challenge our practitioners. We must also challenge ourselves, to ensure that, one, we make those changes that can be made. As I said, if you're using medications like ibuprofen and Voltaren and meloxicam or indomethacin, any of those drugs which are called non-steroidal anti-inflammatory drugs, which are used a lot because a lot of people have chronic pain, back pain and knee pain, and there are individuals who dispense them like candy, and individuals use them for prolonged periods. And not only there are many other consequences, right, that these drugs have. But I want to speak specifically to renal failure, right? These drugs, if you take them every day for a prolonged period, your kidney function undoubtedly is going to be affected, right? So that indiscriminate use, because every time we take something in, it's absorbed in the GI tract, into the circulation. Once it hits our bloodstreams and is broken down into the metabolites, the little byproducts that are going to, one, deal with that pain, but the rest that the body is going to convert into all different things, it has to be filtered through the kidney. The effects, systemic effects, all over, right? It has bearing and repercussion in those kidneys. And that's why it's so important. A person who's a diabetic, and diabetic nephropathy or diabetic kidney disease, apart from all the other diabetic neuropathy and the nerve pain, or diabetic retinopathy, which is the eye issues that you get, the kidney issues are the ones that really scare me the most. Because, again, one of the biggest problems is the cost to the family. And not just the cost financially, it's also the cost psychologically and emotionally. Because here is that you have someone who becomes, all the resources go towards caring for this individual, right? That person is not somebody who is able to contribute one way or the other to the family. A lot of the emphasis, a lot of the resources financially go towards that individual. And it's also the fact that you literally look at an individual whose quality of life is so severely diminished that the compassion that is required, and unfortunately, the general scenario here is that when someone has that problem, somebody has to go out and work or find the money to pay for it. That person no longer receives the sort of compassion that they so deserve. The diet needs to change, because the foods that you would eat, the foods that are high in potassium and so on, you can no longer eat those foods. The way the food is prepared needs to change completely. It takes an entire family circle to revamp their life to cater to this individual. Well, very few families can actually make those kind of adjustments. Very few families can make those kind of adjustments. So if you're out here and you're diabetic and you're telling me that you've not done an HbA1c, which is a test that allows me to get an indication of what your blood sugar, because people come to me all the time and say, well, you know, doc, when I check the blood sugar, it's 120. And they say, it's good, sugar is good. I said, well, okay. Let's do an HbA1c, which is called a glycated hemoglobin, because that test, this is the guy that's going to tell me the truth, because the body is remarkable. I tell people the body is actually remarkable. The body has, I spoke about redundancy, that there's two kidneys in case one gets messed up. Now I'm talking about a test where the body's able to keep a record of what your blood sugar has been for a period of time, right? So I can do an HbA1c, and as a diabetic, I would like yours to be between below 7 at least, right? And I do your HbA1c, and your blood sugar today is 120, but your HbA1c is 9 or 11. Well, what that's telling me is that today your blood sugar is controlled, but over the last 3 months it hasn't. Immediately I need to start thinking of the type of counseling. I need to understand precisely what is happening at home. What are some of the dietary transgressions? What are some of the things? I understand it. I get it. This is not me being condemning. Me being a doctor does not make me any more compliant or disciplined about it. I struggle with the same things. I work for prolonged periods and I forget that I'm hungry. And when I do think I'm hungry, the closest thing to me is a bread. A long one with $5 and $7 one. And there's cheese that I can put in there and butter I can put. That's the reality, right? It's quick to make. It tastes really, really good, right? And my belly full. You think I'm going to cook some broccoli now? And some things broccoli I'm thinking about. I'm a Caribbean man. A macaroni pie, and when I want a half a pie or a whole one. That is the reality, because you're craving the carbs, because that is our culture. So I totally get it. So when I tell individuals about meal prep and, you know, don't start cooking when you're hungry, have things prepped for when you are hungry, right? It's something that I am also putting into practice myself. When I pass the bread, I don't buy bread. Because the meat is bread at my home, right? And I know that my work does not always allow me to have a meal with the regularity that I would like to.
So that would answer the question.
Sure.
Not to stop. Somebody with poor circulation, they could have kidney failure as well.
Oh, great question. That's a fantastic question, because you see, we use the term. So that's a great question. So we use the term poor circulation. And poor circulation usually refers to people, I mean, you look at the legs and say, well, you know, the leg, when you walk a little bit, the veins getting bulgy and painful, and the legs getting a little swollen at the end of the day, and you have poor circulation. Well, and dark. But this is also a manifestation of what's happening on the inside, the things you cannot see on happening on the inside, right? So often that those things that you see, because of course, remember, and just to you know, digress a little bit, but just to answer his question, I love this. The only way, you know, I again, just to speak of how, and I want, if anybody understands anything from this show, is me and how after so many years in this practice, 2 decades, and I'm still fascinated, and I speak about it like it's a romance novel, like I'm in love with medicine and the body. I am, because you know, one of the things I tell people, I say, if God was not in favor of exercise, he would have put the heart in our feet. Because anybody who builds a house and has a pump, nobody puts their pump on the roof, right? Everybody places the pump downstairs to push the water up. But the heart is up there. This pump is actually at the top of the, and you say, wow, this is actually a design flaw. But there's a pump here as well. And the pump here is, the blood vessels are located in between some nice muscular mass. And when we walk and we exercise, that muscular mass contracts and pushes the blood upwards towards the heart. Now by pushing that blood upwards towards the heart here, right? That heart, where's the blood go afterwards? To the kidneys. It pumps it out, it comes out and goes to the kidneys, and it comes back from the kidneys. So the kidney is very much involved in this. So if the circulation is poor here, you can very well imagine that the kidney themselves is not getting a fresh blood supply, because the reason why circulation is poor means that the blood is staying in an area of the heart, of the body, longer than it needs to, than it should. So the kidney are getting a refreshed supply. Remember, the kidney is a living organ. It requires oxygen and fresh blood for its own survival. So when you say you have poor circulation, meaning that when the blood comes there, it's staying there for quite some time, and as it stays there, because you're not exercising, you know, you're perhaps overweight or whatever, the veins become wider, and the veins have the valve that's supposed to meet in the middle to prevent the blood from falling back down. The veins become wider, and the valve don't meet in the middle. The blood, it goes and comes right back down again. That kidney is also being starved of a proper circulation. So that also leads to nephron death. But ever so often, this is also strictly correlated with other chronic diseases. A heart from hypertension. A heart that, because it is a hypertensive heart, it is large. And because it is large, the muscles are thick. The walls are stiff. That heart cannot accommodate all the blood that's supposed to come back. There's 5 to 5.5 liters of blood flowing in the body at any given time, right? And the heart is supposed to be able to take everything that comes into the right side of the heart, pass it to the lungs so the lungs can give it oxygen. Then it comes back from the lungs and goes into the left side of the heart. And then it goes down to the left ventricle, and then the left ventricle, big, thick muscle, squeezes and pushes it right back around, and it goes. The heart is supposed to do that. But if you're a hypertensive patient, it's like one of those balloons here. The heart just gets bigger and bigger. And because a balloon is not a muscle, it doesn't happen in a balloon. But what happens with the heart is that the heart muscle gets thicker. And as the heart muscle gets thicker, it gets thicker from the inside. So the chamber that's supposed to keep blood inside is getting smaller because the heart muscle is getting thicker. And as the heart muscle gets thicker and stiffer, it cannot contract as well as it once did. And it also cannot accommodate as much blood as it did. So the circulation problems you speak of, my friend, more often than not, is also reflective of heart disease. And that heart disease also has a direct bearing on the kidney function. So you see how all this is nicely tied together, right? Heart, lungs, kidney, and it goes, because this is in a closed circuit, right? It's in a closed circuit. And as the kidney loses those nephrons that's supposed to filter, because it's a cup called the Bowman's capsule, the blood comes in, it goes into a nice little, sort of like a bowl of worms, but its blood vessels are just very small blood vessels, and it filters all the extra particles, all the stuff that's supposed to be lost, and that passes down the set of tubes. The kidney so beautifully collects what's not supposed to go out in the first place and sends what's supposed to go back, and by the time it comes, that you have a nice perfect urine, a urine that shouldn't have no sugar in it at all, should not have any protein at all, because those, if you look at the size of those molecules, if you look at the size of these things, if you look at, it's too big, it should never be passing through the kidney in the first place. So when you see them in the urine, my friend, there's a problem. Right? When I take your urine and put it in a dipstick, which is a simple thing, Keisha can tell you. It's an inexpensive procedure. You don't have to have a medical degree or nursing degree to do it. You put that stick in there and you put it against the thing, and you can see glucose, sugar. You know, back in the day, they tell you that, you know, if you lived in St. Lucia, they call it pisadu, right? Which is a Creole term, which means sweet pea. And people tell you that you would know that you have diabetes because ants would follow your urine, right? And there's even old, old medical tales of people who would taste the urine to see if it was sweet. To know if you had sugar, of course. Well, I sure hope not. And thankfully, I did not practice medicine in that era, assuming that it was true. But so those are the things that we have to be cognizant of, right? So you have a situation where you have a disease like this, and a doctor is giving you X medication, and sometimes you don't even go see a doctor because you just go to the pharmacy and say, "Well, I was taking so and so," and then the pharmacy just repeats your medication for you. And all that time, those boys at the back are under some serious pressure. Right? We don't know what's passing in them. And you know what? We collectively urine test, we may not see, when we put the dipstick, we don't see any urine in there. But if we collect the urine over 24 hours and we say, check for me 24-hour proteinuria to see if any protein in 24 hours was released in this. And this is very telling. Once you see this, these are some of the earliest stages of kidney failure. And it means at that point, you have to start looking at practices that make sure that the damage doesn't get any further. If it's your blood sugar, that is properly controlled. If it's your blood pressure, that is properly controlled. And not only is it properly controlled, but also that you are on the right medications. So for example, one of the medications that you want to be on is called an ACE inhibitor, right? An ACE inhibitor, and we know them because they're very familiar, very common to a lot of people, which is lisinopril, which is called Zestril, and the captoprils and all the prils, the ramiprils, and those things are the guys who you want because they help to preserve kidney function, right? So the ACE inhibitors, and then the newer guys called the angiotensin receptor blockers, ARBs, and so on, and so those when you've met a patient or you met someone or even you as a patient and you recognize that this is what you confronted with, you have a responsibility, and patients also have a responsibility. I worked at the hospital where I worked with a great physician, a very person, somebody who I have tremendous regard for, Dr. C. Haley, and patients would say, ask, who's your doctor outside? Say, Dr. C. Haley. And then C. Haley would ask, when last I saw you? And they say, 10 years ago. So C. Haley has a running thing. He would say, patients have doctors, doctors don't have patients. Because if a doctor has a patient, it's impossible that I haven't seen you for 10 years, right? Keisha say, it's like who's caring for you outside? Care nursing agency. When last Keisha saw you? 5 years ago. And you have a wound that needs dressing every day. So how is it possible that you have Keisha as your caregiver, but Keisha doesn't have you as a client? You see what I'm saying? So it's important that you need to have, and the unfortunate thing is that a lot of individuals, their only contact and their primary contact with a physician is in the public care sector. I'm not lashing or knocking the public health care. What I'm saying is that because of the circumstances under which you find a patient, because of the limited resources in any given time, it is not the right place to do that kind of, the emergency room at JNF is not the place to do that kind of in-depth check and study. It's an acute care setting. When you come, the doctor has no choice, so as just so they can end up seeing everybody that's there, has no choice but to zoom in on a particular condition. So you really need to find a doctor that's your doctor. If you have a chronic illness, you should see your doctor at least twice a year, at least every 6 months. Every 6 months you should be seeing your doctor if you have a chronic illness. You can't be just repeating prescriptions for so many years, because I see patients and I ask them, well, you saw a doctor several years ago, so where do you get your medication from? The pharmacy. So pharmacists, my dear colleagues, as well intended as it is, I'm not saying that you don't give somebody the medication. That's not what I'm saying. I'm simply saying that you also have an opportunity there to urge individuals that, yes, I'm going to fill that prescription for you, but make sure you see a doctor, because those are the things, those are the consequences. Your medication might not be working for you any longer. It might need to change because of what your kidney function is, right? Do not dispense long prescriptions for lengthy periods with NSAIDs, right? Somebody shouldn't be on Voltaren for a whole month, 2 months, 3 months. Every day you pop in a Voltaren or you pop in an ibuprofen. That's the reality. So we have to all work together. And I always say that, care. We used to say growing up that it takes a village to raise a child. Well, it takes a village to care for somebody. We all have to play a part in it, right? The family members who recognize that, that person has a chronic illness, and I need to start making those changes. When you start making the change because somebody told you your kidney function is bad, because you went to the doctor and you did a blood test, and the BUN, which is the blood urea nitrogen, is very high, or the creatinine is very high, which are the two things that you use to measure kidney function, right? It's very high. It's very too late. And worse, when I see you and your BUN is high, your creatinine is high, your potassium is high, your hemoglobin is low, right? Because the hemoglobin is low, because the kidney also has a very important function in terms of red blood cell production. So you're pale, your hemoglobin is low, right? Your if I do an EKG for you, your heart function is completely altered, because some of the salts, the potassium and so on, that's supposed to be regulated is not properly regulated, and that has a direct impact. It can stop your heart, right? So the kidney doesn't operate in isolation. If you have kidney dysfunction, your brain is affected, your heart is affected, everything is affected.
So lack of sleep. lack of sleep could affect the kidneys as well?
Well, but there you go. So again, this is why I like the questions you're asking, because the questions you're asking are the very same things that people tend to think they're so far apart that if I'm not getting adequate rest, adequate rest is one thing, is my brain that's tired or whatever, so I need to. But inadequate rest is a stressor on the body. If you're not resting properly, right? A lot of individuals around the place that you see are obese. It's not just diet, It is stress. Stress releases a hormone called cortisol. And cortisol has one of the main actions of cortisol is not only fat, but abdominal fat, right? So if you're not resting properly, you're releasing high levels of cortisol. Cortisol is not only a fattening hormone, it's also one that raises your blood sugar levels as well. So I think I'm already making the point as to how those little habits, and typically the person who's not sleeping properly is the person who's not eating properly. And the person not eating properly is the person who's also obese. And the person who's also obese has underlying heart disease that they don't know about yet, or hypertension that they're not treating properly, or on their way to becoming diabetic. So those things are going to happen in isolation. If you're not sleeping properly, there are a lot of other events that are going to eventually lead to those kidneys. And again, I said that the kidneys, they don't get mashed up overnight. Unless somebody shoots you in the back and damage your two kidneys, or you had an accident where your two kidneys got completely crushed or whatever, But those habits over time, and that's why I'm saying that it's so important that those things are monitored. You don't have to, until you wake up in the morning and your face is round like a Chinese doll, it's called, right? And that's the sign of kidney problems. You wake up in the morning and say, why your face so round and so and you can so swollen and so bloated or whatever, Or then you cannot breathe, and you have to get to that point, because when you get to that point, it's already too late. But the reality of it is that it's happening so much younger these days. In 20-year-olds with kidney failure, secondary to a chronic disease. A 23, 24, 25, 26-year-old person wasn't born with a kidney problem. I started by saying the things, I mentioned some of the things that could happen to the kidney. It didn't ascend properly, didn't rotate properly, has a lot of cysts, something blocked, something this, you have an underlying condition. One kidney wasn't formed, one kidney is small, or two of them are very small. Things that you could be born with. I'm talking about people who were born with normal kidneys and have accelerated the damage so quickly that in your second to your third decade of life, you just arrive on Earth. 20, 30 years, you just arrive. And your kidneys already, in problems. Right? Just imagine that if at the age of 30 or 35 or even 40, before you buy your first plot of land and you put your first foundation down to build a house, or your first child went to college, or you even walk a man or woman down the aisle, you're already spending $70,000 a year, or somebody's spending it for you.
So now, like somebody who can hold the urine, they want urine, sometimes you will like to urine, but you could hold it in some place, but you want urine, so you have to go soon as it is. Right. That problem also. Yeah,
but he's worrying me. Those questions it's like very damn personal to you, but those are good questions nonetheless. Any of those practices that we do, and you see, we know what we should be doing. Women like to hold their urine. That's the one thing I love women, because and it's not that they like to hold their urine. I think our society has not catered to the woman enough. A lot of women struggle to find a place to pee. A man can just go behind somewhere and let it out. Most women have to hold their urine because they just can't find. If you're driving from, let's say, from the time you hit Old Road at least, or even lower, from the time you reach Challengers going down there, and you're a woman and you want to pee, where do you possibly pee? right? So urine is not sterile. And I said that there are a number of things that can cause kidney dysfunction. I spoke about traumatic damage and so on. I spoke about the congenital thing that you could be born with. I spoke about the chronic illnesses, but also it's the infectious components as well, right? So when you don't void your bladder often enough, what you're creating is a nice environment for the bacteria that normally cultivates this area down there to begin to multiply, and they begin to ascend. You see that straw? I told you about the straw that they go up to the kidney there, and that's what leads to the kidney infection, right? So by holding your urine, you're actually predisposing yourself to an infection. And every time an infection takes place, remember, infection, inflammation, and then scarring. And whenever there's a scar tissue, whatever was there as normal functioning tissue ceases to exist, right? So those things that seem completely innocuous, like benign, won't cause any problems, those little practices, they all have repercussions. It's just as if you have a kidney stone. Why does a kidney stone create such a big problem? Well, thankfully, people very seldom at all have kidney stones on both sides, right? But if you have a kidney stone and there's something blocking the kidney and no urine is passing down, that kidney is just the retained fluid that's just getting bigger. A term called hydronephrosis is just getting bigger and bigger and bigger, and it cannot drain anything. Back up, and that's over time it's going to damage the kidney. It's going to damage the kidney. Yeah. So those are some of the issues here, right? So the very same way, if you hold your urine, thankfully there's a limit to which one can hold the urine. Although every time you do that, you start increase the capacity of the bladder a lot more, and thankfully as well, to women who have been pregnant have less capacity not capacity, but they have much more difficulty in holding the urine, right? If you've been pregnant before, you know very well that it causes tremendous compression on the bladder, and it becomes a thing where it sort of weakens the urethral valve and forces you to pee much more often, right? You're pregnant. But for those who want to hold the urine, you shouldn't. But again, as I said, the reason why I'm saying those things is because culturally and societally as well, we have to start changing certain things. There must be places where people can go and urinate often, where they want to. I mean, along the way, it should be a public convenience along the way where you could, where you should be able to avoid your blood. It shouldn't just be frigate because they sell bears there, right? So, so I'm saying those sort of practices, adequate rest, healthy habits, because the person who rests often is also often that person who exercises, is also that person who eats properly. Because if you have time to rest adequately, then you also have time to prepare a decent meal. You also have time to go and exercise. People who don't rest are people who they're too busy to do everything. Too busy to exercise, too busy to... The only thing they have time for is disease. They'll be so busy for everything else, the only thing they have time for is to get sick. That is the reality. Because we're driving our car around, I said before, we're driving our car around and we're too busy to buy gas. And we expect the car to take us everywhere we want to. Well, the car needs gas in it. Right? And our gas is to try. I mean, we have a lot of things that we cannot control. There are a lot of things in the atmosphere. I worry about radiation from all the cell phones. Now we talk about 5G and all these things and all the possible unintended consequences of those things. There are many things in our setting we can't control. There are foods we're forced to eat and buy that we don't know what the process is to produce them. That's why I'm against processed foods. All those colorings and dyes that's in our foods, all those things are harmful, right? So there are many things that we may have difficulty controlling, but there are things that we can control. The way we organize our time, right? A lot of us, one of the things that I've struggled with in the Caribbean the most is that we lack a sense of time. If you live in a first world country, where people have to travel 1-2 hours every day to get to work and home, People, time is very important to them because there's a train that's leaving at that time, and the last train is at 5 o'clock. And you miss it, well, you're in trouble because nobody's going to pay. If you're in New York, you're not going to pay $97 to Long Island to take an Uber, where the train is $3.75, right? So a sense of time is important. We can say I'm going to a place for an hour, 2 hours past, 3 hours past, we're still talking. So we do waste a lot of time because we are not as busy as we tell ourselves. We do waste a lot of time because we don't put a time. We don't value. I was telling Keisha beforehand. I said to Keisha, I value my time. Me being here is me engaging in something valuable. I value my time. Why? Because I start by saying, and this may seem like I'm digressing. I'm not digressing. I'm coming right back full circle, and why time management is so important to our health. If I had to pay myself per hour, my rate for myself an hour is $700 an hour. That's how I would charge. If I could charge that, it would be $700 an hour. So I almost say anything I'm doing has to be with $700 an hour for me. Whether it's spending time, whether it's resting at my home, whether it's reading a good book, whether it's preparing a decent meal. We spend a lot of time with people who would never pay us $700 an hour, or whatever your hourly rate, your ideal hourly rate is. And we spend a lot of time doing things, right, that don't make us $700 an hour. So if you place that value on your time, in fact, as a matter of fact, I have developed a new thing. Now, when people give me their time, at the end I say thank you for the privilege of your time. Like my audience right now. Thank you for the privilege of your time. Thank you for spending time with me, because I know your time is valuable. But we live in so a lot of the things that we struggle with is because we do not factor time into it. So we run out of time in the day. We go to dinner with somebody, or we go to lunch. I went to lunch with someone this afternoon, and I had on my calendar that lunch was from 12 to 1. And when it was 5 to 1, I called up. I said, "What? I said, I can only give an hour. We're done eating. We've spoken enough. Let's get some other time down the line to talk about it." But if you factor this into your thing, you get time for the things that are important, like meal prep, like seeing a doctor, right? Like reading up on your disease, because if you have an illness, imagine you're a doctor, right? You have a particular condition. I tell patients all the time, and I say, let me tell you something. I have to memorize hundreds and thousands of diseases. You only have to measure one. So why should I know more about it than you? You should be teaching me some things. That's your disease. It's not mine. I have to know diabetes, hypertension, cholesterol. Blah, blah, blah. I have to know all those things, and I must still know more than you about your one disease. No, boss. I am not telling you to go to learn all the pathophysiology and go into all that thing and so on. But that's your disease. So when you come to me, you should be telling me about you and your disease. How the two of you are getting along. You have a bad day today, a bad week, boy. Any patient who was my patient back in the day, that's how it would work, I train them in such a way that when they come back to me, it's a story. Boy, doc, let me tell you something. My sister bring one cake you here, and I say, how did that feel? I said, well, me and the sugar, we battling from since that cake came. That's a story. Now you know about your disease. What have you done? Well, doc, I ain't gonna lie, but I up my insulin, to make sure I cater for that cake, because that cake was mango season. Doc, I ate 5 grafted mango today. I know the sugar high. I pee about 10 times for the day already, and it's usually about 3 times I pee. That's people who know the disease, right? But people have a lot of knowledge that is unfounded. Like people tell me, "Well, I know my pressure because my head hurts, my head hurting me." I say, well, let me tell you something. Your headache is more likely to cause your pressure to be high than your pressure to be high to cause your headache. When pressure causes your headache, run, because you're near a stroke. So your headache, when you say I have the pin in the back of my head there, and there's my headache, that's not knowledge. I want you to know your disease in such a way that you understand how your body reacts, you understand what you can do, and when you do that, You actually find a way to live with your disease because you have to find a way to make peace with it. Most people are still at war with a disease that's not going to go away. It's a chronic disease. And if it's chronic, it means that there is no cure for it. You can manage it. Don't get vexed because I say you're going to be on medication for the rest of your life. There's a good chance that you may not, because there are ways that you can control it so much, because again, those things are lifestyle. If they're caused by lifestyle, they can be modified significantly by lifestyle. All right? But people want to have the cake and eat it. And it's your cake. Nobody should eat it but you. But you have to realize that when you finish eating the cake, it's gone. Right? So the very same way with your disease, that if you have a particular condition, you have to recognize that right now I have this condition and I need to make some changes. I said, let me tell you something. Anybody who has a car for 40 years calls it a vintage. Nobody has a car today. Kisha, your car is outside, and God forbid that your car should survive you for 40 years. You don't want to take your car and drive in all the bad road and everything and so on. More likely what you will do, what you might do, well, two things. Well, these days we don't have those kind of cars that are built with that sort of durability, but you would probably give that car to your daughter because you care about your daughter. Or you probably have that car that you take out on the weekends and you have another one that is more sturdy for you to do all your other things with. It amazes me that you have your human body for 40, 45 years and you want to treat it the same way that you did when you were 23. When you're 45 years and that check engine light starts going off, that you have hypertension, you have diabetes, there's protein in your urine, there's sugar in your urine. That's not a death sentence. It's not a death sentence. It's a check engine light that says we need to do something about this. So we can now continue to, you've gotten 45 years of banging that thing left, right, and center, up and down. And now you finally have that check engine light on. Well, start taking care of it now. You've got 45 good years from it. 45 years that you could drink whatever you want to, sleep whatever you want to, wine whatever you want to. You can go out to all the fete that exists, music festival, Music Fest, you're out all 3 nights of Music Fest, and when you finish, you're still going and stop on the strip after Music Fest because you ain't get enough. You do this and now you're 41, 42, and you have a little check engine light on, and you're still vexed. You don't want to take the pressure medication, you don't want to take anything. Well, those are the consequences. And it's even worse when we don't have individuals in our immediate circle who influence us accordingly, because we have people who reinforce all the negative things in us, right? Why don't I just study the sugar? And then you don't study the sugar, and I say young man, and I say young because I think that 40-something-year-old man is still very young, and you have erectile dysfunction and you want Viagra, and you have hypertension, and then your kidneys are working. You want to fix the immediate problem, because the immediate problem is the one you have tonight or this afternoon, whatever time you choose to have sex in the day, I don't know, right? But there's a long-term thing that's coming, that's building up in the back there, which is there's a dialysis chair with your name on it at JNF Hospital if you don't do something. That is the reality, and it takes a community. No one person can do it. I want to do something very clear in people's mind. I may sound very condemning. I'm not. Look at my weight. I have asked this gentleman to put on the Photoshop thing to make sure I look slimmer than I actually am, because I recognize that I struggle with my weight too. I'm sure most of you have focused on my belly since I've been sitting here. That is the reality, right? But we have to do it together. It has to be me as the medical practitioner. When you come to my office, that I must make the money that you spend worth its while. I must check not for the things that you have, but the things that you may have if I don't do the right checks. There are diseases. There are tests that allow us to predict diseases downstream, and that's what I keep talking about all the time. Because the medicine that we focus on right now is so curative and not preventative. If you have diabetes, we know that renal disease is a reality. If you have hypertension, renal disease is a reality. If you have chronic pain, renal disease is a reality. If you have an autoimmune disease, renal disease is a reality. That's a fact. And because I don't want you to end up in that situation where you are a young person, or whether you consider yourself young or not. Well, if you're older, what your time should spend if you're grandson and traveling the world and living life, not spend 3 days a week in a dialysis chair. You cannot travel because we ask you to get your dialysis free in St. Kitts. Just try going to Antigua and you'll see. Right? It's not free. In St. Lucia, it's certainly not. It's $5,000 a week. In St. Lucia. That is the reality. You know what's $5,000 a week? How many people making $5,000 a month? So ask yourself, where does that come from? And we say that the government will pay for it, but it's taxpayers' money that could be spent towards roads or schools or put in, a stroke unit or a cardiac unit at the hospital or something, or improving our ICU, or paying our nurses and doctors a little bit more. That's where it's going. For people, investment in life is never a bad investment. But if you were to approach this from a business perspective, a businessman would say that it's a bad investment because when somebody has kidney disease and you do dialysis, you're not doing it so the person can ever get back to some degree of normalcy. The person is going to continue to deteriorate over time and then eventually will die. So imagine if you start having that problem from very early on, from 40, and you're doing dialysis for the next 5-10 years or thereabout before you eventually lose your life. That is money that's never going to come back. You spend it on fighting a battle that you know you will never win. I'm literally prolonging your life, and this is why I talk about so much about disability adjusted life, is because it's a disability. You are essentially disabled. The work that you once did, you can no longer do it. The quality of life you once had, you can no longer have it. The trips you used to love to take, you can no longer take them. So, I always want to talk about the fact that no one person can do it alone. You sitting out there who may know somebody who's diabetic or hypertensive or may have kidney disease, or you yourself may struggle with one of these illnesses. I'm not asking you to do it alone. I'm saying that if we want to go far, we have to go together, and it takes a community approach. And that's why when Keisha asked me to come here, I'm always so happy to jump on this opportunity to do it, because she understands and she embraces the spirit of community. She recognizes that she may not be able to enter into everybody's home, but she feels that this is a medium where she can touch people's lives. And I am happy to help her achieve that end. If you have a condition that represents a risk factor for chronic kidney disease, I'm asking you to do three things today. Number one, make one lifestyle modification, whether it's increased exercise, whether it's a change in your diet. The second thing is see a doctor. And don't just see a doctor for a repeat prescription. See a doctor to find out exactly where you are. What is your glomerular filtration rate, which means that the amount of substance that is passing through. Remember I said to you of that little Bowman's capsule, that little cup where all the, like a set of worms are in there that filters all the stuff, right? You need to find out how much of that is actually filtering through. What is your glomerular filtration rate? Because if depending on where it is, will determine what stage you are in kidney disease. If it's less than 15, you're in problems, right? So you need to understand that. So talk to your doctor, not the regular doc. Leave the politics out, because a lot of people go into the doctor's office and engage in politics and engage in all kinds of things. That this is not a friendly conversation. Leave that for outside. When you're there on business. Make your notes of the things that you need to get checked properly. If you have all these chronic diseases, you need to know what your kidney function is like. I'm not telling you to do a kidney function test, because you may do it and your BUN, which is your bun, you'll see it at the top, is normal, your creatinine is normal, Potassium is normal, sodium is normal, chloride is normal, an iron gap is normal, but it doesn't mean that your kidney is not already being impaired. So there are tests that can be done to check for that. And if your doctor doesn't know, doesn't make your doctor a bad doctor, but patients make great doctors out of mediocre doctors by challenging them to go out and read more and to explore more and to see what's out there. I challenge the labs all the time. Today, this is my challenge. I challenge a lab. Right? There's tests out there to check for irritable bowel syndrome. I wanted it done. I said, call your lab, call a partner of yours overseas and get the test done, because there's tests that can tell me those things. I don't have to go and do a colonoscopy, and I can do it and it's normal, and there's tests. Those things exist. Go out there and get it done. Right? That's why you serve a purpose, which is beyond just making money. It's also about sensible medicine, sensible healthcare. So that's number 2. So number 1 lifestyle modification. 20 minutes of exercise, and I'm going to join you. 20 minutes of exercise at least 3 or 4 times a week. Okay? If you can do that. Your doctor's visit. If you've just been going to the pharmacy to repeat your medication and you don't know whether the medication it's amazing, people who buy medication, they take it compliant, but don't know what the last pressure is, don't know what the last blood sugar is. I understand that those strips are expensive. Keisha, what would you advise for somebody who needs to get their blood sugar checked regularly? I mean, that is one of the challenges that I face. I know people
Go to the nearest health center.
Okay.
If you come here, a care medicine agency.
Right.
There are health centers all over so they don't have to come to town. There are health centers in the countryside.
Right. So if you're sitting out there and you're diabetic and you haven't seen know what your blood sugar is like for some time, I urge you to, if you're around in the Fort Thomas area, Fort Thomas Road, care nursing agency with Care for Care, or your nearest health center to get your blood sugar checked. You should know what that is, right? You cannot know what time of day it is if you don't have a watch or a clock. So therefore, you should know you shouldn't be carrying a disease around as a ticking time bomb. And Keisha was just saying earlier one before the show started of the health promotion event that she had in the square, where she had cause to refer people to the hospital because people walking around feeling completely normal with blood sugar that is literally a time bomb, or blood pressure that is so sky high, right? So that's important. If you haven't seen a doctor, and if you're a pharmacist out there, I'm not saying don't repeat somebody's medication, because there is good in that, but that's not the end all and be all of it. If you want to make money for a long time, keep people around for a long time, because if they're not around, they cannot pay you, right? So encourage them to see the doctor. I wish I had a private practice. If I did have a private practice, I would see people like I did when I had a practice before. I'm not saying that anybody has to do it. When I practiced medicine before, every Thursday was free in my office, because I refuse to be in a practice and there are people who just feel that $100, because they don't have $100 today or whatever my fees were, they can't come in to see me. So I'm saying that there must be a bit of altruism and philanthropy in the way we practice healthcare. So that's something that we can think of. The pharmacists can also look at ways in which they can actually source cheaper strips, and perhaps ever so often check somebody's sugar for them. All right. So that's number 2. And number three, because there's so many things I'm trying to get. Number 3 here for me is, after you've done something for your body, which is exercise, after you've done something for yourself and for your doctor, which is to go to your doctor and see him, number 3 is to spread the word. Tell somebody else what they need to be doing, because we are a Christian society, we are a Christian community. Do not keep the information to yourself. Kidney disease is real. It is one of the biggest problems, the biggest challenges that the families face financially, emotionally, psychologically. When somebody has kidney disease, somebody has to take them to the hospital 3 times a week, pick them up when they're finished their dialysis. They have to, it is extremely expensive. It is expensive. Your whole life changes So I urge you to go about making those changes. Start small, think big, set big plans for yourself, what your ideal weight is going to be in the next year or so, but start small, start now. I thank you for your time. If there's any questions, yes.
In terms of symptoms,
That's not
what do you look for in terms of symptoms when you come to kidney failure?
Yeah, that's a great question. So the symptoms are varied, and the symptoms are varied because, as I said, kidney failure is not a disease that, and I want to use the term kidney failure as in end-stage renal disease, where there's almost a complete cessation of function, meaning that the kidneys are just not working properly at all. And that's what we used to mean kidney failure. But I would like to think of renal impairment as in chronic kidney disease occurs in various stages, and based on the stage where one may find themselves, the symptoms may be very bit different. One of the classic symptoms of individuals who have chronic kidney disease and just kidney related is based on the fact that that individual can no longer filter all the toxic substances that the body would typically filter. So somebody who does that becomes extremely ill, and when I mean ill, that person has difficulty focusing, constant headaches. That person begins to actually gain weight, right? And one may think that that person has gained weight because weight for us is nothing necessarily alarming. But imagine if I said that that person is losing protein in their urine, and protein is supposed to help us to retain fluid in a particular space in the body, and when that is lost, that person begins to retain that fluid, begins to shift from inside of the blood vessels and begins to shift into the tissue. So that weight gain is not fat or muscle, it's water. Because from the protein loss, that person become what you call very edematous, right? And the edema or the swelling for kidney is different to the one for the heart. The person who has swelling from the heart usually in the lower limbs, so that person wakes up in the morning, the leg is nice and small, and then by the end of the day they have 2 yams there. All right, and when you press on it, your finger can actually see the indentation. The person goes back to bed, their feet up at night, get up the next morning, legs down. Kidney is different. Kidney edema usually starts with the face. All right, it's called a Chinese doll face. So round face, shiny face in the morning. So you see that's where the swelling starts. The swelling is more global, right, than it is for cardiac type of edema, right? But if your body is not draining those toxic substances, it begins to show in the way you breathe. You're out of breath very quickly. But again, more often than not, that person also has symptoms of the disease that is causing the kidney failure. So if you have kidney failure, it means that you also are diabetic who's not controlled. So you have all the symptoms of uncontrolled diabetes. Or if you have pressure that's uncontrolled, you have all the symptoms of uncontrolled hypertension. If you have an autoimmune disease that's causing you have all the symptoms of the autoimmune disease, plus those other things that you see. So typically, and this is why it's so challenging, because more often than not, the person is already coming with those things, and the doctor does your kidney function, and the kidney function is normal, and you think the person is okay, and then you perhaps see a little rise, creatinine climbing up 1.6, 1.7 climbing up, then you're saying, okay, well, that looks a little bit suspicious. But if you had just done microalbuminuria for the little protein in the urine, or collect that urine for 24 hours and send it to the lab, you'd have seen that long before, and you have begun to make changes right there. So those symptoms, again, they're very, very, they often correlated to the underlying condition. But when that person gets to frank kidney disease, that person is the person who has tremendous, just a very ill looking appearance. The person is very pale, because also as well to individuals with kidney disease have severe anemia, right? So the anemia, because the kidney has a very important role to play in the production of red blood cells. So that person becomes very pale, always tired, constant headaches, the swelling, the skin becomes very dry. Yeah.
So the HbA1c test, that's the most accurate. That's where they are clearer picture.
Well, not necessarily. I say the HbA1c because a lot of times we are misled by individuals who, I'll give you an example. People come to the clinic. I was at the medical clinic over there, and people would come to the clinic, and we start at 1 o'clock in the afternoon, but they'll come from about 11. And when I see them, they haven't had lunch or anything. They have type 2 diabetes, and the blood sugar is okay. Right? Does that tell me that you're at the clinic, you're at the OPD to see me, and your blood sugar is normal, or within normal ranges, or not dramatically high? Right, because you're at 1 o'clock and your last meal was something about 11. You came there from 11, you're waiting until 1 o'clock. Your blood sugar is 2-3 hours. Your blood sugar has been normalized already. But the HbA1c, that's how I catch the cheaters. I wish there's a test so for man and woman that that cheating. An HbA1c test, right? Because that's the guy that says to me, for the last 3 months, let's see what your blood sugar has been. So it's not like the most accurate test, but it is an investigative tool, because it helps me to understand whether or not it's because I catch you on a good day at the OPD, and then if I were to check you on a normal day, that sugar would be sky high. All right, so when I see your HbA1c 9%, 11%, and even higher than that sometimes, I say, that sugar has not been controlled, my friend. So therefore, immediately I have to investigate and find out why wasn't it controlled. And the stories are varied. The stories are very varied as to why it's not controlled. I mean, some people, for example, they say, well, they wouldn't have the money to come down from Western Union from their daughter in the States to buy the medication. They get yes, they didn't buy it. Or the hospital didn't have, they get it from the hospital where they pay $10 or $5 or whatever they pay after a certain age. The hospital didn't have it, right? Or when they take the metformin, it makes them feel very bad. Metformin is known to give a lot of diarrhea and so on. So they're gonna get a lot of diarrhea. Okay. Or they missed it because when I take it, doc, and I ate, and then so on them, so many different stories. Or it's mango season, or the sister that sent the black cake, right? So different reasons. Now it is now you to now sit with that person and help them understand why this is a problem, why if this continues, it begins to affect the kidney. It is me to help that person understand that and to make those different changes. If it's mango season, well then we need to cut back on the mango. I don't want people to stop eating mango. I just said you cannot overwhelm your body. Your body has difficulty dealing with too many mangoes at once. You cannot eat 5 mangoes and expect have a slice of a mango today and then later on you have another slice and so on. You can do like the good doctor over there who when she eats mangoes is like she goes crazy on them, right? So you have to recognize that you have an underlying condition. Yeah, so that's why if it's the metformin, I say, well, let's move you to the extended release metformin, which doesn't release so much into the bloodstream at once. The immediate release metformin will give you extended release, and besides, the people like it because it's extended release. I'd have to give it to you twice a day, and it might give you like once a day, rather than twice a day. They're more compliant with it, and because the release is a little over time, because it's extended release, slow in the body, it controls the blood sugar well for them. And the side effects are eliminated. No more side effects from the extended release metformin, and people like metformin because it helps you make you lose weight and get back into that bikini body, right? So people like it a lot. And then of course a lot of people use it because people who have polycystic ovarian disease, which is another thing that I want to talk about. And one day, Keisha, I'm going to come back to talk about diabetes, because diabetes is one of the biggest risk factors for kidney disease, right? But even diabetes too as well, we have to also be looking out for diabetes before they become diabetic. Polycystic ovary disease, which is so common. So many young women today, little beard and so on growing, and and all those are signs that, right? Because one of the risk factors with polycystic ovarian syndrome is diabetes, high blood sugar, increased body weight. It's not just you can't have a child and your period over the place and you're moody and you have a little beard, and not that anymore. It's also the fact that it's also a risk factor for diabetes. So even when you see that, so you have to start saying to yourself, well, so if I start one little metformin, it helps, all right? So those are things we have to. I think we have to increase our surveillance, because we don't have. The reality is we don't have the means. We don't have the means. It's not about money. We will never send kids. It's too small, right, for us to have all the bells and whistles we won't have it. So because we don't have it, we have to engage in surveillance and monitoring, and if not of the disease, of its complications. Make sense? So can we all get on that train? Prevention. Thank you so much. God bless you. Yes. Keisha doesn't want me to leave. I'm sorry, guys.
Drug use, does it play a role in helping to get to kidney failure?
Oh yes, totally, absolutely. Especially intravenous drug use is one of the risk factors. I'm not sure what the drug of choice is in St. Kitts. I haven't had much community exposure in terms of being out working as a DMO, but alcohol definitely. Alcohol is a risk factor for that. Alcohol has a very high sugar content, right? So that's people drink alcohol, but is sugars that create alcohol, right? So alcohol has a very high sugar content, and that's why, for example, when you see people who have alcohol, they have this metabolic syndrome, right? The beer belly, as you call it, that comes with it, and so on, the beer gut. I'm trying to not look at the cameraman, but because then he's going to look at me. I assure you, mine is from bread. But yes, but alcohol is also a risk factor. And again, I would say that those things don't occur in isolation, Keisha. The thing is that the person who's alcoholic, more than alcohol in itself being a risk factor because of the high sugar content and so on, but somebody who's an alcoholic also has an unhealthy lifestyle habit. You're saying that's the person who don't sleep at night, because when you drink alcohol, well, bars stay open very late, right? So and then the diet is very poor. When you're drunk, I mean, you will eat literally anything, things that so, and that's not the person. I refuse to. I am having tremendous difficulty envisaging the alcoholic who does meal prep and has his little broccoli nicely set up in his fridge and his this and so on. It's hard. It's unfathomable, right? I mean, if you know such an alcoholic, I would like to meet them. But I'm just saying that the two things usually go hand in hand. So all these lifestyle things, this is just, so alcoholism and lack of sleep are just manifestations of a much larger problem. And it's all those things together that accelerate the pace. They on their own can cause that, but all those things accelerate the pace towards kidney failure, if we were to look at one disease entity per se. As well. One of the implications of smoking is the circulation. Directly the circulation. People who smoke can actually lose an entire extremity or digits or whatever and so on, because smoking causes severe vascular compromise. Right? People who smoke, their arteries become very, very rigid, and that plaque that is in there, once you have that plaque, it means that the circulation of blood, as we spoke about, is severely compromised. Once that happens, again, as I said, if the kidney is dependent on those 5.5 liters of blood that the body has typically to pass through it, and there's some narrowing. Now imagine in the large vessels, right? So the body, if you look at the body, there's like the arteries, big arteries and so on, big tubes for which blood passes. And then there's the smaller ones. Well, the kidney has remember I told you that there's a bowl of worms in the kidney called the Bowman's capsule? These are little blood vessels. So imagine that if you have circulation compromise in those big vessels that have sufficient space for blood to pass, imagine what's happening to those little guys there with much less capacity, right? So above, so below. Well, so outside, so inside. The very same thing that's happening. That's why, for example, again, remember, those things that we see are microvascular complications. The kidney disease, the eye disease, and so on are microvascular complications. The large vascular complications, which means that the big blood vessels, the heart attack and the stroke and so on that we see. But the smaller things is the kidney and the eye. Right? And now we're talking about, if we just to go off tangent a little bit, arthritis, for example, which we thought arthritis was, trauma and so on. Arthritis is not a vascular disease. Because if there's not enough proper circulation and that sort of thing and so on, it doesn't create enough synovial fluid to lubricate the joints and so on, and it becomes very brittle and stuff. And so everybody hobbling around with a bad knee. Yeah, it's a circulation issue, right? So the same thing that's happening everywhere else is also happening in the kidneys again, and the kidneys play such an important role. Not only that everything that you consume sort of passes through them, not only do they get a taste of everything that you've had, but they're extremely vulnerable. And that's why God created redundancy in putting millions of the little nephrons. But we can destroy that number of nephrons in such a small space of time. And you put 2 of them, millions of nephrons in one kidney, and you give you 2 kidneys, and we're still destroying so much of that at once. Yeah.
So a lot of drinking when people do at December.
Yeah.
Is a factor to it?
Of course. Let me tell you something. One of the most alarming statistics that I saw, well, I saw 2 very alarming statistics, and they both correlated in one way or the other. The first statistic was that the Caribbean had the highest percentage of diabetics per capita, the Caribbean, Latin America, in the world. Most. So if you look at per capita in terms of per 100,000 people and so on, the number of diabetics in that population, we have the highest. But not only that do we have the highest, you know what we also have the highest number of alcoholics. Because, yes, we have the highest number of alcoholics per capita in the world. Right? Because, and you know why? Because most of us define alcoholism by drinking and falling down. But no, it is your tolerance. We consume more alcohol, we just stay on our feet. And that is the problem. Because that speaks to how much alcohol we have. We literally have blood in our alcohol. Not alcohol in our blood. Right? It's almost as if we have alcohol flowing through our veins, we have a little blood in it. So we consume more alcohol, and because we're not drunk and falling down, we can consume liquor, right? Drink a whole bottle and a half or 2 of vodka and drive from here to St. Paul's, and because we got home safe, we're not alcoholics. But by definition, that amount of alcohol should topple a human being. But we tolerate it well. And that tolerance and physical dependence speaks to alcoholism.
I think because a lot of people here use it as a way to solve a lot of problems, like as problem fixer.
Right. We must have a show on alcoholism. But yes, but it is a problem fixer for a lot of individuals. It is alcohol not only is the problem fixer for individuals. The thing is that the Caribbean still struggles with the definition of what a man is. And not just the Caribbean, the world over, but the Caribbean more so. I think it's more apparent in the Caribbean, right? What a man is. Okay? Men are supposed to hide their feelings and hide their emotions and not talk about what they feel or whatever and so on. If you go out with a group of men, let's just take a little drive afterwards, you and I, and we'll drive around and I'll show you any group of men gathered together and alcoholism at the center. Alcohol is the lubricant, right? That is used to facilitate social intercourse. That's what it is. It's the KY jelly for conversation. Without alcohol, we can't talk to each other. That's
as in certain society today, if a man quite is considered he's soft.
Of course. So you're a man going through something, and your friend know you going through something, like your wife bites you, which I learned here in St. Kitts. I thought bite meant something completely different. I learned bite here. Your woman bites you, and your friends invite you out. They didn't invite you to talk about that. They invite you to drown that in alcohol. But let's go, let's get a drink. And nobody has ever spoken about what has happened to you. You crying on the inside, and every time you feel like the tears coming, you just down a little, take a drink, and then you're sitting here, and then by this one made a round, and down. If 5 guys out, that's 5 rounds of drinks, and then another 5 rounds of drinks, right? Because I don't want to be outdone by this other person, and And if you're in the group, like it's happened to me, when I consciously made the decision not to have any alcohol, and I said I have a bottle of water, it was an offense. Because first thing is that the doctor is there having a water, it makes everybody feel uncomfortable. Because people, nobody wants to sit at vibes with a doctor and feel like their conscience is being attacked. You don't invite me out. I mean, you really want to go somewhere on the strip with me, and I'm here, I'm the medical doctor having a water, and you're here drinking, you're on your third scotch. You don't want me around you because I'm the party pooper, innit? Right? So that's the way. We don't say anything to each other, but we drink, and that's our friendships are built around that. And a lot of men, as I said, a lot of men are struggling with that because men today, I'm sure you ladies can identify with that. A lot of men today are struggling to understand what their role is in the family and in the community, right? Men had served the role of protector, provider before. Most women don't need men to do that anymore. We live in a safe society. Women go everywhere they want to without a man in to protect them, right? You're a nurse. Nurses work at 11, 12 o'clock in the night without a car. And they're by the roadside going home and so on. They feel completely safe. They really with a man. Back in the day, a man had to be walking you or meet you halfway to walk you home. So there's no need for a protector anymore. And then provider, because you own your own kip. You own your own money. So if the man is not protector, provider, then what role does he really serve? And then you have Bobs these days, right? You have the battery operated boyfriend. So you've also taken away the function of him in the home. So the man is struggling to decide what exactly he can't talk to you. He calls you to ask where are you, and you don't feel any need to tell him where he is because what you want to know where I'm for? I have my own car. Is something wrong with you? So that is the reality. Now, of course, then you can see how, and just to tie this back, and sorry for this is just to humor you, but this all ties back to why this man can't sleep at night, because you're out at night and he know that you have your Bob. You have your job, you have your own car. He can't sleep, so he drinks. Or he goes out with his friends and he drinks too, because if you're out drinking and he goes out to drink and so on and party himself, and then he's in a group of friends that encourage all these lifestyle habits that are toxic, and you can see why this gentleman, sooner rather than later, the last thing he's thinking of, first of all, is that he needs to go to see a doctor at some point. That's the last thing, because first of all, men have difficulty going to that. Right? But as far as, because he might feel a little thing every so often and say, why, well, and one of his friends will make it even worse, say there's a bush somewhere that he can just drink fat and so on, and he drank that bush dirty and that bush helps, and then he's drinking also have concoction because he's competing with your Bob. So he's drinking concoction to make sure that he improves his sexual prowess, which also have a bearing on the kidney. So many of this bush things, I say, I'm not against bush. I just don't know what's in it.
People drink boom and the Guinness together, which I don't think that's a good idea.
I don't know what boom is.
It's like an energy drink.
And Guinness. And that's to increase your sexual prowess. You see that? There you go. But then Guinness is alcohol. Alright, Guinness is alcohol. Okay, so I tell people alcohol increases the desire, but it reduces the effect. You want it, but you can't do anything with it. That it increases the desire. You want it really bad, but you can't do anything with it. It reduces the effect. So, and then you continue doing this, and then it's not just alcohol, it's also the diabetes, because once that starts happening, the obesity leads to insulin resistance, right? Your body becomes resistant to insulin. Insulin is no longer serving its job in the body anymore. Okay? So, slowly you're going towards diabetes. And by the time you actually realize that you have diabetes, remember that by the time you've diagnosed someone with diabetes, the effects have already been done on all the target organs. And which one is the target organ of them? The kidney.
Even the medication for the diabetes.
Exactly. Right?
Sexual performance.
So, and for the hypertension, so I guess I give you a little atenolol and so on, a beta blocker, and it blocks everything. Right? Everything. Okay? And so you see how the ripple effect. So why we talk about this is the reason why the way we fix this, Keisha, is that we have to have a comprehensive solution. It has to be start from the home environment, the family, the relationship we have, the relationship we have with our spouses, with our friends, with our community. I'm not knocking everybody. I take a drink every so often, right? I'm not knocking. This is my culture. I understand it. But our culture is no longer working for us because we've pushed the boundaries way too far. And we need to dial things back a bit now. We need to have sensible conversations. If you have a group of male friends, at some point, you have to ask yourself, when was your last prostate check? When was your last pressure check? When was your last sugar check? If you're my buddy and you're my great friend, I'm going to the doctor, I should be saying, boss, I'm going to the doctor, let's go to the doctor together. That's all I'm asking for. And this is not so we can fill doctors' offices with patients. It is so we don't fill the morgue with dead bodies. That's what it is. Right? So that Keisha can, when she comes from her shift and she's tired as she is right now, she can go home and rest. Not engage in all these public service announcements and try to curb these attitudes. So we can do sensible work. Let's work on preventing those complications and preventing those diseases, not trying to chase after them. So all these things that I spoke about, which was the object of some humor, is a very, very serious thing. We can do this differently. Yeah.
One last question, doctor. I've heard many people say in the past they go to the doctor, some with diabetes, some without, and they do the kidney test, whatever you call it, and the results, the doctor will tell them, you had a little protein in your urine, but it's not to worry about, just increase your intake in water. Yeah,
that's not good enough. Okay, that's not good enough. And it's not good enough because one, that test, that whatever test that's been done is not protein is if you were to look at, let's go down to chemistry right now in terms of the size of molecules. If you can't see it just by looking at it, but it's there. Everything is made up of particles inside of it if you would look on the microscope, electron microscope. Protein has one of the largest molecules, and by the virtual size of protein, it should never pass through the kidney. Right? Because that thing is, that Bowman's capsule, the bowl of worms that you're talking about, is like a strainer, and the holes in the strainer should never allow the protein to pass. Once protein is passing through there, there's a problem, especially in the absence of an infection. So you may see an infection, you may see protein because there's an infectious process going on. That's a different thing, right? Because bacteria eats glucose and it poops protein, and you may see it in the presence of an infection. But if there's protein in your urine, normally it warrants a check. The minute I see protein in your urine, I'm not saying that something is so wrong that let's run and raise a 5-alarm fire. I am saying that let's collect your urine for 24 hours, and if there's more than 3 grams of protein in that urine, then there's a problem. Collect it, a 24-hour proteinuria. That's the next step. You cannot say drink water. What do you want to do? Try to dissolve the protein? No, it shouldn't be there in the first place. If it's there, let's see why it's there, and let's see how much of it is there. And let's see what we can start doing right now to start changing things around. So those are the little check engine lights that goes off that we ignore. And then by the time we check, we have to buy a whole engine for the car, which is called dialysis. So those things they're not normal. They're not.
No, that's called kidney transplant.
Kidney transplant. Right. Okay, well, kidney transplant. You see, Keisha has them by the kidney, which we don't do here, which we don't have, right? So that is the reality. And kidney transplant is also a life-changing thing. Yes, you get a new kidney, but I'll tell you, your body can reject that kidney several years later, several months later. The drugs you need to be taken every time just to make sure that your body does not reject it. Your quality of life is still impaired. So it's not like you get a new kidney and you get a new lease on life. I've seen cases though, unfortunately, I've seen cases where individuals have gotten a new kidney and still bring that new kidney to kidney failure. It happens. And you know why it happens? Because the kidney failure was a consequence of the things that person did not change. So I'm saying that when you see those things and that protein in the urine, you drink water, it's part of a larger conversation. And sometimes we as doctors are not the best equipped. And that's why I'm calling them nutritionists and dietitians and nurses like Keisha and these things. Because sometimes, depending on where, look, doc is here. When you go to her emergency room, that's where she doesn't have time to do that kind of counseling. But she sees something and says to you, that's a problem, you need to see somebody about it. And sometimes all you came there was for a headache. Quite frankly, I don't think anyone should go to the emergency room and not have a urine dipstick done. I think that should be routine. I think anybody who passes through I don't care what you came for, You should get your blood sugar checked. You should get your blood pressure checked. You should get a urine dipstick. That is the basic, because that's where you can capture the students into you. Wow, I know you're here for your headache and everything and so on, but this, you need to check on that. Go and see Dr. So-and-so, go and see your doctor, whatever the case may be. Those are the areas where we capture those things. Every time we have a chance to touch somebody, have contact with someone, we should take advantage, because a lot of the serious things I've diagnosed in my career is coincidental findings. Things that people didn't come to me for, but just being thorough about it, I discovered something and said, wow, what was that there? People come to me for little things and discover a lump in the breast by doing a complete exam. I say, what? But I know for anything. You check on that. And lo and behold, it's breast cancer that you got very early. Or the man who comes to you and you don't check his prostate, and then his PSA is very high and he has prostate cancer. So I'm saying we can be thorough about it. We should demand it. We should request it. We should challenge our doctors to want to do it, our healthcare practitioners to do it, and we should also care for ourselves and for our body. Yeah. Thank you very much, and thanks for the privilege of your time. All the best. Bye-bye.